There's a lot to this side of space. Regardless of what college you're on, you go through an application process. As part of this process, you'll likely need to prepare a resume and participate in an interview. Time frames for this will be communicated by your college and your training coordinators. There's 2 intakes a year. It's administered by both colleges and also the RBTS, and you apply directly to them. If you're doing that in that process, there's also information on our website about that as well. We'll talk about this more going forward. So for those who are out to find a practice, it can often be a bit overwhelming, and it's the where do I start side of way, what's going to be the best fit for me. So we'll talk a bit to that tonight. One of the things initially to look at is do a bit of research on the practices in your area that you're likely to apply for. So have a look on their Google and have a look on their websites. So any details that you can see of the GPs working there to get a bit of a feel. Do they have any nurses or any allied health or visiting non-GP specialists there? What's the billing structure at the practice? Interesting as well, the demographics where the practice sits. So for an example, when I worked in more of a rural location as a registrar, I saw a lot of older people, chronic disease. When I worked more in the metro side of things, younger people, a lot of women's health, a lot more pregnancy side of care. And then out of metro, it was a bit of in between. So everywhere is going to have a different demographic based on the people that it serves. When applying for a training placement, you'll need to prepare a resume and a CV. Similar to a cover letter, you want to keep these very clear and concise. So practices you think you're going to be inundated sometimes with multiple people applying. So think about what's going to make yours succinct but stand out. So you don't want to be, as a practice, reading through 7 pages of someone's resume or CV, no more than 2 or 3 pages at once. Tailor it as well for where you're applying for. So think about what it is about that practice that you're really keen for. The cover letter is really where you sell this. Why should they employ you? And prepare in that side of way to interview in that side of practice. Interviews, most people hate interviews, but in general practice, unlike the hospital area, it's as much of an interview often for the practice as it is for yourself, because it's got to be the right fit for both of you, because often it's a smaller business compared to the hospital where it's small fish, very big pond. Think about why you want to work there. What are your strengths and weaknesses? Some other side of questions that might come up. How have you dealt with a difficult patient or difficult situation? How and when you've made a mistake? Some of the very typical interview questions may come up, but I was often surprised in some of the interviews about how much of more of a chat and a get to know you that it was compared to some of the more formal hospital interviews, but every practice is going to be different, so prepare appropriately for it. Always confirm what you need to provide for your application and do exactly just that. So don't submit an application missing a cover letter. Always personalise, as I said before. So while you might be applying for many different practices, don't make the practice feel like you've got to cut and paste. It's a really bad look if you're applying for practice A, but you've got practice B's details on that side of things. As I said, cover letter, keep it brief. This resume, think 2 to 3 pages. Cover letter, no more than 1 page. Keep it specific, exactly what you're applying for and why they should hire you.